welcome to the third World Congress of Cardiometabolic Medicines. You are seeing us from TheRightDoctors.com from Hotel Leela, Mumbai. We have with us Dr. Rakesh Sahay from Hyderabad, who is here to talk about precision medicine in diabetes and also how to battle obesity from brown fat. So, doctor, what do you mean by precision medicine?
Yeah, so I think what I would like to say is that we have a large burden of diabetes. We have about 100 million people with diabetes in our country, and today we have a lot of medicines available. Earlier we used to have just one or two medicines which everybody used to get. Now we have different medicines available, so we need to understand which are the patients who would benefit from a particular medicine and which are the ones who would not benefit from a particular medicine. So that is what is called as precision medicine. Today we have ways of doing that. Recently there were some studies where this was shown that you look at all people with type 2 diabetes, they are not the same, they are different, each one of them is individually different. And if you look at certain parameters, simple parameters like the age of the person, the age at which he developed diabetes, his weight, his BMI, his the amount of insulin that is being produced in the body, the insulin resistance. So if you look at some 3 or 4, 5 or 6 such parameters and the lipid levels also, we can actually cluster them into different groups. So there are some of them who have more of insulin resistance, they require medicines like metformin, and there are others who have got more of insulin secretory defect, means they are very much deficient in insulin, they are lean and thin. They are the ones who will benefit from early use of insulin. And these clusters have also been shown to be correlating with the type of complications that they develop also. Some of them who have significant insulin resistance are the ones who develop kidney disease, while the ones who have significant insulin deficiency, they will go on to develop more of heart disease and also eye disease. So these are ways, I mean these are things which we understand by this clustering, and we can use specific medicines for managing these patients. Apart from this, there is another subset of people who have got something called as a MODY, that is the diabetes is little different. They start early in life having diabetes, they have a milder form of diabetes, and many times because they are young we give them insulin, but then we realize that they are probably having a defect in insulin secretion, and they respond very well to tablets. This may happen even in very young children in the first year of life, when you have a very small child of 3 or 4 months. I was just showing one such patient who was at 4 months of age diagnosed to have diabetes, and everybody would think that such a patient requires insulin, and we also started with insulin, but we did not have very good control, and later on we did the genetic analysis, found out the defect which was causing this, and once we found that out, started the child on tablets, and the tablets worked in that situation. So it's not for everybody, but for where we identify these patients.
Clinical trial, or it's in clinical practice also we can do
Yeah,
this?
in clinical practice also what we are saying is that this is what is becoming a reality today. What was earlier thought that we may have something like that, today we can say that it is becoming a reality, and we are able to understand which are the patients who would benefit from which form of therapy and use them early, because we have 7 different types of medications available for diabetes today. We have metformin, we have glitazones, we have got SUs. Yeah, so we have, and then the 2 new classes of drugs, the SGLT2 inhibitors and the GLP-1 analogs. A lot of discussion happened during this meeting today on these 2 molecules. So I think understanding which of the patients needs these molecules very early in the course of diabetes is also very important.
Indians have so much fats. What are the type of fats in the body, and which is the good fat and which is the bad fat?
Yeah, so I was actually speaking about this concept of supercharging or activating this brown adipose tissue. So basically, to put it very in simple terms, we have the fat is an organ which should store excess energy, but fat is very active also. Fat is active, it produces a lot of molecules, we call it as adipokines, which have various types of activities which affect the glucose metabolism, they affect the lipid metabolism, they cause heart disease, they cause fatty liver. So all these things happen because of the fat being active, and so we can say that of the fat that is present at birth, we have a small portion of fat called the brown adipose tissue, which is present only in some locations in the body, and the rest of it is white adipose tissue. So the white adipose tissue is not so good in terms of producing a lot of harmful molecules, the adipokines, harmful adipokines, while the brown adipose tissue is the better one, which remains inactive during the entire life. It is active in say small children and in fetal life. It is very active and it uses a lot of energy, utilization happens. So the concept that is being developed nowadays is that whether we can activate this brown adipose tissue, so that what happens is more energy expenditure happens, less of energy storage, and we have less of fat accumulation. So that is something which I was speaking about. This is something which is work in progress, we can say, but some good things about this is that simple things that we already know of, exercise increases the brown adipose tissue.
Okay.
Then we have some simple food stuffs that we eat. Curcumin, we speak about the benefits of curcumin, we speak about berberine and all these things. So these are all natural food substances which we know have antioxidant properties, have some benefits. They are actually shown to increase the browning of adipose tissue.
Is there any way which we can measure how amount of brown fat, and is there any way to increase the brown fat to tackle obesity and diabetes?
Yeah, so I think one of the things that we can do for measuring brown fat, although we don't have a very simple parameter, but people have done PET scans and shown that the glucose uptake in the adipose tissue and shown that it is higher in the brown fat. So that's not feasible for every person, but we can look at the metabolic parameters, looking at the presence of metabolic syndrome parameters, the indicators of metabolic syndrome being present along with obesity, to say that this is metabolically healthy obesity versus metabolically unhealthy obesity. So what we see in our population is that even with normal weight, most of our population are metabolically unhealthy. So that is the challenge. And with regards to causing browning of fat or making the fat more metabolically beneficial or better, is exercise is one important thing which has been shown to have the benefit. Then various dietary products like antioxidants that we are knowing, naturally occurring antioxidants like berberine or curcumin, that is traditionally known to us, we use it very often. So all these things are shown to have very great benefit, even red chilies. So all these things have great benefit. Apart from that, the type of food, I mean the way in which we eat our food, the intermittent fasting is also shown to work through increasing brown adipose tissue. So these are simple things that we should exploit and we should use it to our benefit. While there are many medications being tried out, there are still studies going on, animal studies and human experiments need to be done before we can say that these molecules are going to be good, like glitazones or even beta-3 adrenergic antagonists, agonists that we speak of. So all these things require some more time before we have more data on that, but I think till that time, more important things are exercise and using healthy eating is going to be good in terms of increasing the brown adipose tissue, or we call it as beiging of adipose tissue, or even supercharging of the brown fat. In different ways we can call it, but this is something interesting which we should all try to adopt a healthy lifestyle to improve this metabolism. Thank you.
Insights from the world's best medical minds. You are watching TheRightDoctors.com.